It is very possible for a woman who has had a cesarean section before to have a normal delivery, but there are conditions which this woman has to fulfill before she can have a normal delivery. There are ones which are above her powers, and there are ones which she can control in order to have a normal delivery after. Welcome back to our channel, Talk Pregnancy with Dr. Nuella, where we tell you everything about pregnancy and all women related health issues. So if you're new to our channel, please click the subscription button and also the notification button, such that if there's any new video, you'll be the first to receive that video. So to our subscribers, thank you very much. So today we're going to be giving the conditions in which this woman has to fulfill before she undergoes a normal delivery after a cesarean section. So this woman has had a cesarean section and she wants to have a normal delivery after. So what are the conditions she has to fulfill, or before the doctor has to even say, let us try and have a normal delivery this time? So the first conditions, we always try to say either the conditions which fulfill for the mother and that of the baby. So for the mother, the first thing is it should be one cesarean section. Even though in other countries, once they have done 2 cesarean sections, they can still try. Secondly, the type of cesarean section which was done, it should be one which the cut was at the lower part of the womb. Even though there are other situations, this one the woman cannot control because she does not know which one was done, but she can ask her doctor so that she can know. But most of the cuts which are done are the ones at the lower part of the womb. Her pelvis should be adequate. What do we mean by her pelvis are adequate? That means her pelvis should not be contracted, because there are women who normally have contracted pelvis. Most of the times in women who are a bit short, they usually tend to have a contracted pelvis, but this one is evaluated by your doctor for you to know that you have a contracted pelvis. Maybe in people who have also delivered before, then maybe the second one is a cesarean section. The next one, at least you can be sure that you have a good pelvis, an adequate pelvis, because you had undergone a normal delivery before. Next thing is the age between the first pregnancy and that of the second pregnancy. Once you have the first pregnancy, you should give a gap of at least 2 years. So what does that mean? That means that if you have the first baby, you have to wait at least 1 year and 3 months before you can take in for the next baby, such that by the time you want to deliver, it should be 2 years from the time of delivery of the first one to the next delivery. So if you take in when your baby is 1 year, for example, that means that you'll be giving birth. The time when you will be giving birth is when this child will be 1 year 9 months. So it's still remaining 3 months for you to make 2 years. So in that case, once you just go and it's calculated, you'll just say it's a cesarean section. So they're not even going to check the other conditions to see even you fulfill all the other conditions and this one is not fulfilled, you cannot still undergo a normal delivery. Why? Because you have not given time for the wound to heal, to undergo contractions. The next is the mother should not have any illness. They should, maybe if you have a scar, and for example you have severe preeclampsia, you have severe maternal illnesses, maybe you're sick. So we don't want anything that is going to have so many emergencies. The previous indication should not be the same as this one today. So if she had severe preeclampsia for the first pregnancy and that's why she was operated upon, and this second pregnancy, if we just see severe preeclampsia there, we just take her immediately. We don't even let her go into normal level. So the indication for the cesarean section the first time, if it's the same indication that we are seeing here now, we just operate her. We don't leave her to go into normal level. So with regards, that's for the mother's condition. And that if for the baby inside you, The first thing is that it should be one baby. Once it is twin, triplet, quadruplet, we operate you. We don't even leave you to go into normal labor. Why? Because the uterus has expanded, the womb has expanded in a way that if it even goes into contraction, that wound might open, and that is an obstetrical emergency, which is uterine rupture. Next, the baby should not be too big. There's a weight which is given. It should be less than 3.5 kilograms. So once your baby is above 3.5 kilograms, the risk is that that wound might open because the baby has over distended the womb, making that wound to be a little bit weak, which it can burst open. Then this baby should be coming with the head. This baby should not be transverse. This baby should not come with the buttocks or the legs. The baby must come with the head, especially during the third trimester. That's around 37 to 38 weeks of pregnancy. That's almost the time of delivery. Once they see that the baby is not coming with the head, we don't even leave you to have a normal delivery. You have to fulfill all of these conditions. So it's very important you know about these conditions. So the ones in which you can work on are the intergestational age. That's the age between the first baby and the next baby. So you can work on that by taking better family planning measures in order to space your baby rightly. Then you can also work on your weight. You know, when women say, I'm pregnant, I eat for two, you just eat and you just eat. No, it's very important you watch your weight, but make sure you eat. In fact, for this my second delivery, before I was managing my meals so well, but I made sure I ate so well. So one thing is you can work on the intergestational age, the weight of the baby. Those are if a baby is breech, you can do some small exercise to help the baby's head turn and present down there. So if this was helpful, please give a thumbs up to this video, and if you want us to discuss about any other thing, you can drop it on the comment section. And thank you very much.